And now we're going to ask Deborah Delgado Pugley to present on some of her work on mainstreaming gender and social inclusion in conservation and climate change responses. Thank you.
Hi, thank you very much for pushing for joining these voices here and organizing this panel. I'm learning a lot from these presentations. So I'm going to take you to another place in the continent, in the world, to another continent, another reality, but has a lot of that has a lot of parallels to be made with what you just presented. It's not a context of open conflict, but of slow violence, where indigenous peoples have been exposed to discrimination, and particularly on health issues and global health issues, like and environmental injustices for a very, very long time. And I've been working with indigenous organizations on climate responses, and it's from this standpoint of view that I started to work about COVID. And yeah, because before that, I worked with oil spills and climate change in Peru. So as these presentations show, the responses of COVID have been multi-level, and I will focus on the grassroots response linked to the subnational level. But of course, what I'm presenting has several layers, several levels. I'm focusing on the agency of grassroots organizations. And yeah, we still don't have enough information about how COVID has impacted indigenous peoples and the Amazon basin as a whole. The day before yesterday, a study conducted by Montreal University had some interesting insights on how COVID has affected indigenous peoples communities in the Amazon basin on Loreto Nucayali, which is the first quantitative study that has already been published, but is still preliminary. And what I'm working on with a grant of the SSRC is the response of indigenous organizations, and I'm focusing a lot of indigenous women role in these organizations and how do they acted facing COVID. And what I'm going to present is some preliminary findings on that. And what I wanted to stress is that the context where they came from to act about COVID had to do with a long story of self-organization and then some support coming from climate policies that gave them some budgets to strengthen their organizations as indigenous women. So yeah. So what I'm going to show you here, it's a grasp some starting points of an ongoing research that we will finish the fieldwork in November. What we are describing is how do women act and how COVID and its aftermath will affect indigenous people's position and their organizations and their territory. And this is Santiago Manuin, who was a very important indigenous leader. And he died from COVID after resisting bullets on his body during the Baguazo uprising here in Peru that resisted legal changes that were as ambitious as the ones that Bolsonaro is it's forcing into the Brazilian law, but were resisted in Peru and didn't pass through. So just to give you an idea on how COVID has impacted indigenous people's leadership. He was a historical leader, and he has been one of the victims of this crisis. And the first image that you see here, it's a painting that was done during COVID to commemorate the resistance of indigenous peoples to colonization during all these hundreds of years. So I'll focus in Peru, then I'll give you just a little brief context of the Panamazonian reality now, and then some underlying conditions on what is lacking for a proper response to COVID and perspectives after the outbreak. So first, I wanted to give you some examples on how the lack of territorial coordination had consequences for the Amazon basin. So one of the main, the most affected areas has been Loreto, the one here, and they had a lot of victims, 2,541 registered victims, and now the number of people that is hospitalized is few, and so our first wave is over, but the toll has been pretty high. What indigenous peoples did to resist this was to isolate themselves, but anyway, the answer of the state has been pretty detrimental. They have received therapeutics that were not adjusted, hydroxychloroquine, and has been given to indigenous peoples, which is not at all recommended. And the subsidies that the state has given to indigenous peoples and anyone that was under the poverty line made an incentive for people to leave their communities that were isolated and get COVID. So it's actually the state that drive the contagiousness of COVID. And also in Ucayali, the people that is more connected to urban areas had very high tasa, a very high toll of cases. And the region we're working on is the red one here. It's called Ucayali. And what we are focusing on is on all this network response to very scattered and slow strategy from the state to focus their actions on indigenous peoples. One very interesting example is what indigenous peoples called Comando Matico. Matico, it's a plant that has very good therapeutic characteristics for for mild cases, and they have organized places for to host people and isolate people that had mild cases and accompany them out of the crisis of respiratory crisis mainly, using these traditional knowledge and recipes out of this plant. So they have recovered these recipes around Matico and other plants and send them the recipes around by WhatsApp, surpassing frontiers from Colombia to Peru, from Peru to Brazil, and inside the subnational levels to share the recipes that may work better to treat the mild cases, isolate their communities, and isolate the people that had some kind of crisis. But of course, the social distancing wasn't practiced as it was practiced in Occidental context. So that is one thing that we're focusing on. But the action was taken. At the same time, this is a video of a recipe being done, a Shipibo women sharing this recipe of different plants that proven to be effective. But they didn't stop to this recovery of traditional knowledge and innovation from it, no? Trial and not much error, actually. And they also criticized the slow strategy of the state And they had pointed to the lack of articulation and request budget for a proper plan to approach them. So their leadership and the women leadership was key on this. So this is Tabea Cacique. She works at the Pan-Amazonian level, but she is from Ucayali, and she was very, very key talking about this, pushing forward a proper plan for indigenous peoples coming from the subnational level. And at the national level and international level, ONAMIAP, which is the national organization, criticized the lack of health services, that is an underlying condition, and they started a legal action that started in June 17th, and they demand the state, and then it was taken to the CIDH, which is the Human Rights Commission at the Inter-American level. So you see there's different kind of actions and leadership that indigenous women has taken to react to the pandemic crisis. And in the context of the Pan-Amazonian reality, you see that and the frontiers have been a focus of contagion. I mean, the borders between the countries. And you see the points here of where we found in May the cases of COVID concentrated. So again, just to give you a context, Amazonas was the most affected area from where the cases went to Peru and to Colombia. So it's important to take into account that borders in the Amazon basin are very fluid. People travel around, and as well as their knowledge. So it's important to take into account that the action that Bolsonaro takes in Brazil has consequences for Peru, and what he has been changing in the health system and in the law for the protection of indigenous people's territories have a long-lasting consequence for Peru and Colombia because of the size of the country and how they content their health crisis was a positive action for us, and now this is not working anymore. Colombia has the same dynamic, is the frontiers that were more affected. So Leticia was a very focus of the pandemic. So what changes might be coming and what changes should be coming? Well, health systems in the Amazon are a key priority. We know that other pandemics might actually start from the Amazon basin. So we see a lack of capacity there, and the situation is exacerbated by the lack of budget for transportation of medicines and protective equipment. There's also no capacity to attend to moderate and severe cases with a high risk of death. So that's why indigenous women acted. And there's a deficit of health personnel because they contracted COVID-19 and they couldn't go to the community. So it was a perfect storm produced by the historical lack of health infrastructure, and then how the virus worked. So indigenous women particularly responded to these conditions. And what we see in the future is that development projects and reactivation may be imposed into these territories again. So to close up, what I think is like a fast balance is that the countries in the region have acted without coordination. And even at the subnational level, the coordination was pretty poor. We observed timid attempts at the subnational level that may be interesting. So Ucayali for us is a case because they did answer and hear indigenous peoples. So we think we might learn from this. no? And these kind of cases, we see them also in other areas, such as education, for example. When a grassroots organization has a capacity, built capacity, a subnational level government may support that capacity. So maybe that it's a lesson learned that we can use for other global health challenges. So this space where the grassroots organization and the subnational level meet may be a way forward. And this is my main message. And there's where we can promote in the women leadership, because it's there, and it's just a question of lifting it up. Yeah, so we have a region that is still not resilient. If we have actually not a pandemic that comes into the region, but a pandemic that starts in the Amazon, which is pretty probable, and we know that that can come from zoonotic diseases, we have to think about how the resilience of the region. And what we are starting to see is that a path forward is these social ties of solidarity that we see on the ground from the grassroots level up, these networks that are there, that have been there for at least 30 years and historically from way before, with a gender focus. Because if we use the gender lens, we start to see the leaderships that I'm trying to present you here, and they are the most effective ones. And another thing that we have to take into account is to distribute better the resources and optimize the built, but also the natural infrastructure. At least in the Amazon basin, and I would argue that in many other cases, natural infrastructure, so the rivers and many other ways, the paths, and have to be optimized so we can use them to be more resilient and not destroy them and be less resilient in the forthcoming crisis. So that's my presentation. This is an ongoing work. We are still collecting data from Ucayali, very interesting interviews there, and conversations and material, cultural material, all the propaganda that they use to spread the information and everything. So yeah, so this is what we're doing, and I hope it's useful for you. Thank you.